My friends, this is Dr. B, the best doctor in medicine. 30 years of experience in medicine. Today, Dr. B wants to talk to you about a very important topic of our health care. I want to tell you about why is it that in the future, our health care will never improve and get better. Not only that, but it will get worse and worse and worse every year. Our healthcare, my healthcare, your healthcare, our healthcare, us, the middle class, the doctor, the plumber, the carpenter, the bus driver, whoever the cazzo you are, the guy who has a restaurant, right? The computer engineer, this guy, that guy, the dentist, the hairdresser, and the guy who works in a restaurant, and the chauffeur, the bus driver, the taxi driver. I mean, you know what I'm talking about. I'm talking about the middle class. People who, like you, me, everybody else in the middle class, 80% of the population, right? 80% we are the middle class, means we don't have millions of dollars in the bank. We work hard, very hard for our money. We pay too much tax, right? And this is the middle class us. I'm not talking about the millionaires and billionaires. They will have better health care and they don't care at all because they can buy any hospital, they can buy any doctor, they can buy any clinic. To them it's pocket change, right? So their health care is the best in the world and it will get better and better for them, right? Us, the middle class, right? All of us, 80% of the population. Why is it that our healthcare will get worse and worse and worse in the future? The answer is very simple, guys. I want you to think first about our population in the United States of America, right? We have about 350 million people, a little bit less, right? The exact number doesn't matter, but you get the point. We are about 350 million people in our country, the United States of America, right? Now compare us to Canada, our neighbors in the north, right? They have only 40 million people, right? 40 million people, right? Compare our country to other, for instance, European countries. Let's look at Sweden, Denmark, Norway, Netherlands, all these European countries, Australia, Greece, Spain, blah, blah, blah. They have only a few million people, right? So think about comparing a country like Sweden, that has only 10 million people, right, to the United States. So people say, ooh, look at that. In Canada, they have universal healthcare coverage. Ooh, look at that. In Denmark, they have great healthcare. Okay, but Denmark has only 6 million people to cover. Right? Ooh, look at that. In New Zealand, in Australia, they have universal healthcare coverage, everybody covered, right? But guy, Australia, they forget to tell you that Australia has this huge continent, right? Has only 27 million people to cover. 27 million, it's nothing. Right? Australia, this massive continent, right, has only 27 million people to cover, right? They tell you Switzerland, one of the most beautiful countries in Europe, has universal healthcare, everybody's covered. Okay, but Switzerland has only 9 million people, right? 9 million people. We, the United States of America, we are almost 350 million people, right? So these are countries that we cannot compare to, right? Nobody can compare the United States to Canada, right? Nobody can compare the United States to England. England, right, our ally in Europe, has about 57 million people. They have what we call the National Health System, the NHS, right? Which, like every national healthcare system, is going bankrupt, is a disaster. Just ask the Canadian up north, right? It's a disaster, right? Just ask the Australian. Their healthcare is a disaster, long wait list, waiting time, blah, blah, blah. You get denied for this, denied for that, blah, blah, blah. I mean, it's a disaster. The national health system in the UK is going bankrupt. Not only that, but it's a disaster. So these countries that have so little amount of population, right? Again, I'm telling you, Canada, 40 million, right? They can't even handle 40 million people. Their healthcare is a disaster, right? Every Canadian comes to the US to have better care. Every Canadian goes to Thailand to have cheaper healthcare. Every Canadian goes to Mexico to have cheaper healthcare, more affordable. They are running away from their own country, despite Canada having trillions and trillions and trillions of dollars of oil, gas, minerals, uranium, everything on the ground, right, in their soil. Canada has so many trillions and trillions and trillions of dollars of natural resources, right? But they are not exploiting those, not exploiting them because of these environmentalist lobbies and all these cooks, right, who are crazy. So the country has trillions of dollars of fortune on the ground, right? Trillions of dollars, minerals and uranium, this, that. I mean, it's crazy how much money Canada has under its soil, right? But they cannot exploit it. They cannot use it because of these crazy extremist environmentalists, right? So their healthcare is a disaster, right? Like everything else. The cost of living in every Canadian city is a disaster. I mean, inflation over there is a disaster. Homelessness, drug addiction, everything is going up. Anybody who has been to Toronto or any other big city, right, in Quebec, it's just a disaster, right? It's just a disaster, right? So our country, right, 350 billion people. Does anybody believe that we will one day be able to provide universal, high-quality healthcare to 350 million people? It's just not going to happen. Not only that, but we have $37 trillion. $37 trillion, not million, not billion, of national debt, right? So all these politicians who come and tell you that, you know what, I have a plan for our health care, right? Whether it's a Democrat or a Republican or an independent, they are lying to you. Your health care, I'm talking about you, the middle class who is watching me, carpenter, plumber, bus driver, taxi driver, restaurant owner, business owner, dentist, plumber, computer guy, blah, blah. The guy who works hard, who doesn't make millions of dollars every year, right? Who doesn't own mansions and Ferraris and Lamborghinis and doesn't travel in private jets and blah, blah, blah. To you, my friend, your healthcare is gonna get worse and worse and worse. I live in California. Our healthcare system is a disaster. Our state is bankrupt. Not only the federal government is bankrupt with $37 trillion of debt, right? Our California government is bankrupt with hundreds of billions of dollars in deficit, right? Millions of homeless in California, millions of drug addicts, millions of poor people, millions of people living under the poverty level, right? Millions of people have do not have healthcare insurance. Millions of people who do have healthcare insurance provided by the federal government called Medicare, or by the state government called Medi-Cal. Medi-Cal is Medicaid for California. We call that Medi-Cal. These people have insurance coverage, but they don't have access to healthcare, because doctors and hospitals do not accept their insurance, right? I work at a cardiovascular clinic, right? If we were to see a patient on Medi-Cal, the insurance, the government of California would pay us $50. If we are lucky, they would pay us $70. Out of that, we need to pay tax. Out of that, we need to pay the rent of the clinic, the employees, and my God, it's crazy the overhead that there is. It's like a restaurant, right? When you look at a restaurant, it's not all profit, right? The restaurant owner has to pay the rent, the food, the employees, it never ends, right? So that's why we cannot accept medical patient. The poor person has medical because low income, right? The government of California say, I'm going to cover you at taxpayer expense, right? I'm going to give you free health insurance called medical. But the guy cannot use medical because nobody accepts medical, because medical doesn't reimburse enough money, any doctor, any ophthalmologist, any optician, any dentist, to make it profitable. It's a waste of time for the dentist, the doctor, to see such a patient for a long time and then get only $50, right, before tax and before paying the overhead. Better not see that person, right? It's sad, it's very sad, but that's how politicians are. Politicians, guys, they don't care about you and me, whether it's in Washington or whether it is here in Sacramento or any other capital of any state. It is the same thing. They want to be voted in office. They care about power, money, and the glory that comes with being elected, right? Our governor, Gavin Newsom, provided free healthcare coverage to millions and millions of undocumented people. He never asked himself, who's going to pay for that? Where is the money going to come from? Right? But now that the state of California's healthcare system is bankrupt, he woke up. He realized that, you know what, you need hundreds of billions of dollars to cover a population of California. California, guys, have 50 million people, right? Let me look at it. Yeah, California, I apologize. California has 39 million people, right? 39 million people, among them millions and millions of undocumented people. It costs hundreds of billions of dollars to give free health care to these 39 million Californians, right? It's not cheap. It costs a lot of money. So this idiot governor just woke up and realized that, you know what, our state is now bankrupt. We can't even pay the pensions of the state employees, whether it's city or state or blah, blah, blah. It's a disaster, right? And in the future, it's going to get worse and worse and worse. So do not expect, guys, that your healthcare is going to improve. As I said in another video, in the year 2023, we don't have yet the statistic for last year, which was 2024. Right now, I'm posting this video today. It is June 6, 2025. We don't have the statistics yet for last year, 2024. They will come out. But we do have the statistics for 2023, and we spend $4.9 trillion our country, the United States of America, spend $4.9 trillion on the health care of its population. And the population is in the disaster situation. I mean, look at the disaster of our population. Half of our population is overweight, 30% is obese. They are dying like fleas of heart attack, cancer, strokes, blah, blah, blah. Our children are in a disastrous situation. It's just a disaster. Our mental health is a disaster. People committing suicide at a high rate. People going into mental institutions. There's no room in hospital. There's no room in mental institution. It takes forever to make an appointment with a doctor, with a specialist, blah, blah, blah. The cost of healthcare is rising and rising and rising. Next thing you know, we're gonna go beyond above $5 trillion in healthcare expenditure. It's getting more and more expensive. It's becoming less and less affordable for the middle class, and less access to healthcare because of the increasing population. We are 350 billion people in the US, and every year it's getting more and more and more. Think about China and India. They have almost 1.5 billion people, right? In China. Compare 350 million people in the US, right? Compare that to China and India, 1.5 billion people. Do you really believe that the 1.5 billion people in China or in India get healthcare coverage and good healthcare treatment and prevention? Of course not. They live in massive poverty, misery, dying of all these diseases and everything. So what they do, they export their population, right, to the rest of the world. The same way Japan is in the business of exporting cars and electronics all over the world, right? China and India, what do they do with their 1.5 billion people and growing? Well, guess what? You go to Europe, this one goes to Australia, this guy goes to America, that one goes to Canada. They just export their people because they cannot feed them, they cannot take care of them, they cannot provide them health care. And America is going down the drain the same way all these other countries are going down the drain. It's not gonna get better. Just look at our neighbor southbound Mexico. They are supposedly giving universal health care to their population, but that is a disaster. The health care over there is a disaster. Their population have absolutely no access to health care, except if you are a foreigner and you go pay over there to get good health care, or if you are a rich Mexican, right? But the poor little guy, they are dying like fleas. It's a disaster. They are even worse than we are. And they have like 180, I forgot, let me check. Do I have Mexico? Yeah, 130 million people. 130 million people in Mexico, right? It's crazy, right? So the overpopulation, right, that is growing every year, the massive amount of national debt or state debt, and the massive increase in the cost of everything, from mortgage rate, from rent, from food, from gas, from electricity, everything is constantly going up, right? Even though now at a slower pace, right? Everything keeps getting more and more expensive. I haven't seen anything becoming cheaper. And I live in California. It's going to get worse and worse and worse. They are predicting that next year our gasoline will hit $6 and that the other year is going to get $8, right? Now that they are shutting down all the electricity, all the coal plants and nuclear plants and everything, and putting all these environmentalists in charge and everything. We're going to have in California gasoline next year supposedly $6, and in 2 or 3 years going to reach $7, $8. Levels that we see in Europe. It's just a disaster. So guys, don't expect the government to do anything for you. Get in charge of your healthcare. Don't trust blindly your doctor, right? Do not trust your doctor blindly. Make sure you listen to my videos about what to do for your prevention, what to do to be healthy, because what you want to do is need as low as possible healthcare in the future, now and in the future, right? So that you stay away from all these doctors and hospitals and clinics, and you don't need them at all. Maybe once or twice a year to do a regular routine checkup, right? And I swear to God, you can do that. Thanks to Dr. B, with the help of Dr. B. Dr. B loves you. Dr. B doesn't give a cat's about your race, your gender, your ethnicity, your politics, whether you're a Republican, a Democrat, an independent, or anything. I don't give a cat's. If you are a human being, then I love you. I love medicine. I love people. And I want to help you, right? I want to help you to stay away from having any need for healthcare other than simple, easy preventions once or twice a year in the future until you reach 100 years old like Dr. B, right? Guys, I swear to God, it is easy. Follow me, listen to what I say in the videos, and follow what I'm saying. Follow this constellation of measures that you can take without spending any money buying fake stuff, buying stupid stuff online that have no proven scientific benefit, right? Don't get fooled by all these charlatans online. Listen to Dr. B. Dr. B is genuinely here to help you, right? So that, God willing, I can keep teaching you medicine and educate you about your healthcare for the next 50 years to come. I'm 50 years young. My blood pressure, my vital signs, everything, all my liver function, kidney function, cholesterol, sugar, blah, blah, or those of a baby, right? Because I follow all these constellations of measures in my life that keep me healthy. I'm 50 years young, but I look better than 90% of 20 or 30 or 40-year-olds out there, right? My tummy's flat. I have no fat. I have no visceral fat, no love handle. I sleep 9 hours a night. I put my head like a baby. I wake up I go to bed at 9 o'clock. I wake up at 6 o'clock. I exercise 2 hours a day, no exception. I read and keep my brain constantly busy. I have a low stress job. I have a low stress life after work. I love my work. I'm passionate about my work, blah, blah, blah. And of course, I zip it. You need to zip it, guys. You see this? After a certain age, you need to zip it. And do like Dr. B. I have only one official meal in the morning. That's it. I have one official breakfast, and it's a tiny breakfast. During lunch, many times I don't even have lunch. If I have a lunch, it's a little snack of nuts and a little bit of olive oil, walnut oil, a little fat-free, 1 tablespoon of fat-free yogurt. Same thing for dinner. After my gym, I have a protein juice mixed with cocoa butter. I mean, watch my videos and you will see. And that's how you age gracefully, by zipping your mouth after a certain age. You do not need all this food you put in your stomach 3 or 4 or 5 times, all these fruits and vegetables full of sugar, all this stuff, all this bread and pasta, nasty stuff you keep putting in your body after a certain age. It was good when we were young, when I was a kid, a teenager growing, when I was a young athlete, when I was in my 20s, 30s, 40s. Okay, now I'm 50 years old. I have to zip it, right? You need to zip it. Otherwise, you're going to have big problems, right? My friend, please invest in your future healthcare the same way you invest in your bank account and retirement account, right? And God willing, Dr. B will be with you for the next many years. Watch my video, because I tell you what to do in simple, easy ways. Dr. B went into medical school because Dr. B loves people and Dr. B loves medicine more than anything else. Guys, I love you. Keep your comments and questions down there. If you have any, I will get back to you. I promise it might take time because I'm so busy with work, 8 to 10 hours a day, but I love it. That I have to take some time also for my gym, sleeping, blah, blah, blah. But I will get back to you. I love you. I give you a big hug from far away, and hope to talk to you next video. Bye-bye.